I became interested in science when I was in college and worked in a lab and had a wonderful experience. And when I got to Duke, the MD'78 program had a profound influence on my career.
That career has David Ginsburg firmly established as an internationally respected clinical and research expert on the molecular and genetic foundation of several bleeding and clotting disorders. His pioneering work includes being the first to clone the gene for the bleeding disorder von Willebrand disease. This led the way for better diagnosis and treatment for this hemophiliac-like disorder.
And I was starting out at the very beginning of that revolution. Today, this is a trivial exercise that an undergraduate student or even a pretty capable high school student could do at a computer in about a nanosecond.
He has defined the genetic basis of the deadly blood clotting disease TTP that causes microscopic clots to form in small blood vessels in the kidneys, heart, and brain.
And these patients, usually in their 20s or 30s, perfectly healthy, suddenly get catastrophically ill. And untreated, the mortality is about 80% in the first 2 days.
Clinical trials are currently underway on a new therapy for TTP that his lab developed. Ginsburg has spent his entire career at the University of Michigan, where he arrived in 1985. One of his current research focuses is on the gene PCSK9 and its relationship to cholesterol. His lab found a gene in mice that regulates PCSK9 and dramatically lowers cholesterol levels. This work has great implications for human health.
PCSK9 has become a major target for treating cholesterol. There are now 2 approved antibody drugs that lower this.
Ginsburg came to Duke University School of Medicine in 1974 after graduating with honors from Yale. He points to Duke's noted hematologist Wendell Ross and hematology fellow Judy Anderson as key influences in his decision to study diseases of the blood.
He was like the neatest, coolest guy, but we all knew he was this brilliant physician-scientist.
He cites Anderson's enthusiasm for hematology as an important motivator in his career choice. After Duke, Ginsburg trained for a year in San Francisco and 7 years at Harvard. He has been recognized for his pioneering work with induction into the National Academy of Sciences, the National Academy of Medicine, and with invited lectureships around the world. But he says what he's most proud of in his nearly 35 years at Michigan is the people he has trained and watched go on to become department chairs, deans, and division chiefs.
Paying forward the training that I got, giving back what the wonderful mentors I've had over the years have given to me.
Ginsburg and his wife Maureen have been married for 36 years. They have 2 grown children and 2 grandchildren. The couple enjoys riding their tandem bicycle and following college sports. David follows Duke and Michigan. Maureen follows Michigan and the University of Wisconsin, where their son graduated. In 2015, when Duke beat Wisconsin in the NCAA Men's Basketball Championship, a Duke friend sent Maureen a Duke t-shirt. Unfazed by the humor, she immediately fashioned the t-shirt into a diaper and sent her friend this photo of their granddaughter, Nina. For David, though, there is no debating what Duke means to him.
I owe an enormous debt of gratitude to Duke. Can't imagine I would have done any of the things I did or had the career I did without that critical launch from Duke.